Okay, this is a presentation about SDF. So if you go into YouTube, I've done lots of these videos on SDF, but this is one sort of slightly different. And a lot of what I'm talking about you can find on the careforteeth.org website, which is clearly aimed at, well, not clearly aimed, but for care homes and carers. And so you can also find me on LinkedIn, and this is sort of about the black box. We need to ask questions, and unfortunately we're in a hierarchy where people don't actually question why we do things. To improve dental access, please sign the form on the Dental Health Service website. Now this is about human behaviour, and what we look for at times. It's partly about when you go shopping. There's many studies about what you look at and what you're looking for. And in this game, that, as you can see, it's done a while ago, people didn't see the gorilla walking through them. And we're doing the same in dentistry. So I went to this mobile conference this year, that's the one for next year, and it was because I'd heard the woman talk here, Sarah, and I joined this organisation and watching some videos, and a bit like this, hardly anyone viewed them. But if you go onto the my YouTube website, then you'll hear what she says. And she notices that the gingiva was a lot better. So there are her details there. And really, she should be talking to us. And it's difficult to find. So amongst the series of lectures that I saw before I went to the States was one by Jeremy Horst. And I asked for pictures using ChatGPT because it's, as we know, it's a good resource. But it could hardly find anything of what Sarah was talking about. But what we can see is the gingiva's improved. But what we were looking for was how we've used SDF to treat cervical caries. No one's thought about the gingiva because you weren't looking for it. And that's what Sarah mentioned in her video. And for anyone that's interested, you can join the AMTA as it is for free because we're abroad. And so these are just a couple of the references that I could find. And when I say I found them, it would have taken me months. But, ChatGPT, it went quite quick. Although in this case it was something different, which was called Storm. And on this one, again, this one, I should have left the reference on. Oh, it was the same person, I think. Right, but and you can see, look at the slides between B and C, and they're like 3 years apart, and see how the gingiva is a lot better, which basically means there's less disease, which, as we know, means that the teeth are less likely to fall out. But also, in this day and age, we're concerned about what bacteria are there in the gums and how it affects, can we get pneumonias, especially in care homes, about that. And so again, this is just another reference, and these were the ones that I could find. When I was there, I asked a couple of people there why there wasn't any more research in this field, and the common opinion, which is what I thought as well, is that Silver Diamine Fluoride is too cheap, and that's a problem. Anyway, so this was produced by Jeremy, I'm pretty sure, and it was just guidelines. And, we always worry about what we're going to do in research, especially on people. I mean, the research, they've used dogs. I could have an argument that we wouldn't do it to a dog. But basically, these people are, applying the Silver Diamine Fluoride, to put it bluntly, it might save people's lives and make them live longer and healthier, which is what we're about. And then this, all I was going to say here was that the whole technique, which is one of the few new innovations, doesn't come from research from some academic group or university. It comes from someone discovering what she did almost after she retired. And we have the evidence there. I think all we need is to look for it. And she, as it says there, she was an outlier. And so again, using AI, we can help with prevention, but it can't do the treatment. But the whole idea is to avoid treatment. And so, these are the things that I put on the website for carers. So some of the research that I've done over the weekend is there. I just added this to my website. But prior to that, I've learned AI. There's an LLM behind this. So you can ask the assistant anything regarding the health in the care home, And this is another thing about 3D printing. We should be doing a lot more of this, and we need to scan dentures before they're lost. And nothing's really going to change unless we change the Dental Act, which is what this is here. So that's really just for like the general public and carers. And then I've done a bit more for dentists, if you're interested. And yeah, so some of the research, or rather the interest I've had in dentistry, you can find here on the website. And I will update this website. I made it during COVID. I'd made a presentation. So if you can imagine, I've only ever done one Zoom presentation, and they wanted me to do it for 3 hours. Well, you know, this I put it on my trial run on here, and even I haven't watched it. But I have looked at the slides, and these are slides from there. So this one here is about 1983, the year after I qualified, and I've been quite fortunate. I've never really, you know, definitely not academic, but I know some quite bright people. And so at the time in Cardiff, I knew, because I knew oral microbiologists, that they were playing around with metronidazole in acrylic rods. So I was making my own there and putting them into the pockets of people there and seeing how that worked. And obviously we used the perio pill, but we're not allowed to use antibiotics now. Obviously, you know, willy-nilly, you have to go to the hospital for that. But the perio pill, I think, was pretty good. But obviously it's all about keeping, it's up to the user, that is society, to clean their teeth better. And this was one of the things that there is really keen on in Cardiff, was Corsadil, and you know, it was the best thing since sliced bread at that time, and all the research showed the fantastic results it had. So I invested in a Cavimed, and I used to, you know, do the scaling and then squirt Corsadil around all the gingiva in the pockets, and it did work for a while, but it was transient. And the thing that we now know is that, you know, it really, it's abused to a huge extent, and it's marketed. You know, Corsadil is a brand, and I'm not sure which huge global conglomerate has it now. I think it's GSK. I mean, and so they're kind of moving away, and they made the Corsadil toothpaste. I don't think it's got chlorhexidine in anymore, but clearly they're protecting the brand, and that's one of the problems with research. So this is slightly different, is that the person there was a patient of mine, and he was saying about the effect of ozone, how it killed all no germs, which it does. But and I said, I've come across a machine that says you can use it in the mouth. And so we went together to look at the machine in Cardiff again. And to be frank, the research as it was described was never going to be great. But it did seem to work. And Gary pulled the machine apart, more or less, at the meeting, and says, yeah, it's amazing, it's a really good bit of kit. So I used it a lot, and there's a diagonal dent there, and with some success, I think. And it did, yeah, the other thing it did was I used it for angular cheilitis, as it said there, and it worked really well for cold sores. And I used to put a lot of glass, I'd use it, and obviously needed to seal on the tooth. Never got round to using it for endo, which would have been very good. You couldn't find how to do it. We didn't have YouTube back then to watch people doing it. Anyway, I used it a reasonable amount, but you couldn't really, well, I really didn't charge for it. But that's one of the things that, oh yeah, the reason I put it in was I thought that I was making suck-down splints, and I thought I'd be able to make a suck-down splint that would sit over the gingiva and oxidize the pocket. Well, right, later on, I got rid of my Cavimed. I think it broke. I also used it for endodontics. I seem to remember using it for endodontics as well, with the ultrasonic files that you could use for endo. But anyway, I got rid of it, or it broke. And I ended up with one of these type of units. And I went to see the professor of perio in Bristol to ask him the percentage of hypochlorous acid I could use in the pocket, because I thought, well, maybe rather than just putting sterile water down there, something that may, reduce the bacteria in the pocket may be a benefit. And so we had this discussion. He said, well, nobody knows. And so I said, well, what about hypochlorite? And he said the same. He said, well, nobody knows. I said, well, why not? And he said, well, there's no research for it because it's too cheap. So this was the thing that I used for the hypochlorous. I couldn't find a picture on it, but I had a Sterilux unit. Again, that was, I'm pretty sure that Gary told me about this. And so we used that a lot. And that was very good. I'm not sure if any of you have had it. But then years later, this started coming out about what was the best mouthwash and how actually hypochlorite mouthwash was if anything better than Corsadil, because you can't say it tasted much worse, but it didn't cause staining. And so again, I've just done this AI course, so I went on to ask which was the best mouthwash. I also asked if mouthwashes were worth having at all, but I'll put that somewhere else. And these are fantastic tools for going through the research, because a lot of the papers, I haven't read them all, but I have a general idea on what's going on. And so the actual article in its totality, I've stuck on the teethforlife.org website, as you can see there. And, they were my thoughts on perio 5 years ago and what we could do. And this is one of them. I don't think it'll play. I think it'll say it's a fault, but that's actually on the website. And I went on a course called Perio Courses, which actually was an excellent course. So this is the one thing that I do recommend Corsadil for. You just have to apply it directly on the lesion, as you would say. Oh yeah, it's playing. Anyway, so I made this on Doodly if anyone's interested. So I think that's a repeat. Sorry, I'm in a hurry. I've got to go to look after my mum. Yes, and so this slide was actually asking about SDF for periodontal disease, which is what I mentioned earlier. And so again, I've got this, where did I put it? Anyway, you can ask me. But basically, there isn't any good research on it. As you can see, there's only one article talking about the effect, and it is quite recent, on the clinical trial. And it just, many of you are probably aware that it says it does has a positive effect on reducing gingivitis. But surprisingly little going on there. And the other thing that was said about it was, going back to Sarah in the States was told that SDF corroded implants, but she had really good results with it. And we've got people going into care homes who can't look after their mouths. It's, as I've written here, it's 3 times more difficult to clean your implant than it is a tooth. And obviously the dexterity is getting worse. And then you need the oral health champion in a care home to be able to do it, trained to do it, and allowed to do it. And then we've got lots of people now who are having implants thinking, everything will be fine. Well, if you've ever been on a course in gerodontology, seeing what happens when these implants or large restorative units fail, it's far worse than losing a denture. And then you can't make a denture for people who, you can, but they don't get on with them. But we should be making more implants. I would even argue that if someone's got a large implant, a retained bridge, you should be taking the bridge out, leaving the implant, and making good overdentures, because obviously you can take the denture out and clean the implant. But anyway, I asked, and this time I think I asked ChatGPT about if SDF does any harm for implants. And I've got the article written down, or you could even do it yourself. So it's a shame that there isn't anything going on here. It's worse than a shame, it's almost criminal. So I've made some videos about this, and these are quite short ones. If you type in SDF into my YouTube channel, Teeth for Life, then you'll be able to see them. And there are a variety of things there that I think can help in care homes. So on the website, if you look up innovations, as it says there, it'll bring these videos up. But you can also go onto YouTube. And on YouTube, there's the longer video, and there's one on here on SDF. It's 53 minutes long, and it shows how, basically nurses can apply SDF to children in schools. But in the last 5 minutes, it shows Sarah applying SDF in the care home environment. And if you look closely, you can see that's had 254 views. But the one on the top right about how we can make replica dentures, or at least get the dentures scanned before they are lost. That's another thing that we can do to help people. And the one that's got 47 views is about teledentistry. And I think it says how we could do that. But it's only got 47 views. And anyway, I've given an intraoral camera to a care home, because if a dentist is going to go to the care home, at least it'll indicate what the problem is. We can do so much more, but we need to empower dental nurses, especially in the UK, to do it. So I'll just add a slide at the end, and on the reference I'll say where you can sign the document to empower nurses and the rest of the dental team at change.org.